Question 1. Stakeholder feedback indicates a veterinarian has instructed a certified veterinary technician specialist, VTS, in equine nursing to administer a prescribed medication via a route that deviates from the manufacturer's recommended guidelines and standard veterinary practice for this specific drug and condition. The veterinarian states this is based on the owner's request to minimize perceived discomfort for the horse, despite potential implications for drug efficacy and absorption. As the VTS, what is the most appropriate course of action? Option A. Refuse to administer the medication due to the deviation from standard practice and manufacturer guidelines, without further discussion with the veterinarian. Option B. Discuss the veterinarian's instructions with a senior veterinary technician to get their opinion before proceeding with or questioning the administration. Option C. Seek immediate clarification from the veterinarian regarding the rationale for the altered administration route. Express concerns about potential efficacy and absorption issues, and advocate for adherence to established protocols or a mutually agreed-upon alternative that prioritizes patient safety and treatment success. Option D. Administer the medication as instructed by the veterinarian, assuming the veterinarian has considered all factors and is acting in the best interest of the client and patient. Correct answer is C. Seek immediate clarification from the veterinarian regarding the rationale for the altered administration route, express concerns about potential efficacy and absorption issues, and advocate for adherence to established protocols or a mutually agreed-upon alternative that prioritizes patient safety and treatment success. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a client's perceived best interest and established veterinary medical protocols, particularly concerning medication administration. The veterinarian's directive, while potentially well-intentioned from the client's perspective, deviates from standard practice and could lead to adverse effects or treatment failure. The veterinary technician specialist, VTS, in equine nursing is ethically and legally bound to uphold veterinary medical standards and patient welfare, creating a dilemma when faced with a directive that may compromise these principles. Correct approach analysis. The correct approach involves seeking clarification and expressing concerns to the veterinarian. This upholds best professional practice by prioritizing patient safety and adherence to established medical guidelines. The VTS has a professional responsibility to ensure medications are administered according to the veterinarian's lawful order and in a manner that is safe and effective for the patient. By engaging in open communication, the VTS can address potential misunderstandings, highlight risks associated with the proposed deviation, and advocate for the patient's well-being within the bounds of veterinary medical ethics and regulations. This aligns with the principles of professional responsibility and the duty of care owed to the animal. Incorrect approaches analysis. Administering the medication as instructed without question or clarification represents a failure to exercise professional judgment and a potential violation of the duty of care. It bypasses critical assessment of the proposed administration method and its potential consequences, which could lead to patient harm or ineffective treatment. This approach neglects the VTS's responsibility to ensure the safety and efficacy of medical interventions. Refusing to administer the medication outright without attempting to understand the veterinarian's rationale or express concerns is also professionally unsound. While the VTS may have valid concerns, a complete refusal without communication can create an adversarial situation and may not be the most effective way to ensure patient safety. It fails to explore collaborative problem solving and could be perceived as insubordination without proper justification. Consulting with another technician for a second opinion without involving the veterinarian is an insufficient step. While peer consultation can be valuable, the ultimate responsibility for medication administration and treatment protocols lies with the attending veterinarian. This approach circumvents the proper chain of command and fails to address the core issue directly with the prescribing veterinarian. Professional reasoning. Professionals facing such dilemmas should employ a structured decision-making process. First, identify the ethical and professional conflict. Second, gather all relevant information, including the prescribed medication, dosage, route, and the client's request. Third, assess the potential risks and benefits of the proposed administration method versus standard practice. Fourth, communicate concerns clearly and professionally to the veterinarian, citing potential risks and advocating for the patient's best interest based on established veterinary medical knowledge. If concerns remain unresolved and patient welfare is compromised, Escalate the issue through appropriate channels within the veterinary practice or regulatory body. Question 2. Assessment of a 10-year-old quarter horse gelding presenting with a mild, intermittent cough of 2 weeks duration, and the owner noting slightly decreased appetite, requires a VTS to determine the most appropriate initial diagnostic approach. The horse is otherwise bright and alert. Option A. Focus solely on the owner's report of coughing and ask if the horse has been dewormed recently. Option B. Immediately administer broad-spectrum antibiotics as prescribed by the veterinarian. Option C. Perform a thorough physical examination including respiratory auscultation, thoracic percussion, assessment of mucous membrane color, and capillary refill time. Option D. Advise the owner to administer over-the-counter cough suppressants and monitor for improvement. The correct answer is C. Perform a thorough physical examination including respiratory auscultation, thoracic percussion, assessment of mucous membrane color, and capillary refill time. Explanation. Scenario analysis. This scenario presents a professionally challenging situation because it requires the VTS to interpret subtle clinical signs of a potentially serious respiratory condition in an equine patient. The challenge lies in differentiating between a primary respiratory issue and a secondary complication, and in recognizing when immediate, advanced intervention is necessary versus a more conservative diagnostic approach. The VTS must apply their specialized knowledge of equine respiratory physiology and pathology, coupled with keen observational skills, to make a timely and accurate assessment that directly impacts patient welfare and treatment outcomes. Correct approach analysis. The correct approach, which involves a comprehensive physical examination focusing on respiratory auscultation, thoracic percussion, and assessment of mucous membrane color and capillary refill time, represents best professional practice. This aligns with the fundamental principles of veterinary diagnostics and the VTS's role in assisting with patient assessment. Specifically, it adheres to the ethical obligation to provide competent care and the regulatory requirement to perform thorough patient evaluations, as outlined in Veterinary Practice Acts and professional guidelines for veterinary technicians. This systematic approach ensures all relevant physiological parameters are assessed, leading to a more accurate diagnosis and appropriate treatment plan. Incorrect approach is analysis. One incorrect approach would be to solely rely on the owner's subjective report of coughing without performing a thorough physical examination. This fails to meet the regulatory and ethical standard of care, as it bypasses essential diagnostic steps and could lead to misdiagnosis or delayed treatment. It demonstrates a lack of professional diligence and a failure to uphold the duty of care owed to the patient. Another incorrect approach would be to immediately administer broad-spectrum antibiotics based on the owner's report of coughing, without further diagnostic investigation. This is a premature intervention that bypasses crucial diagnostic steps, potentially leading to inappropriate treatment, antibiotic resistance, and masking of underlying issues. Ethically, it violates the principle of do no harm by potentially treating the wrong condition or causing adverse effects from unnecessary medication. It also disregards the regulatory requirement for a veterinarian's diagnosis and prescription for controlled substances like antibiotics. A third incorrect approach would be to dismiss the cough as a minor, self-limiting issue without a complete physical assessment, especially if the horse appears otherwise normal to the untrained eye. This demonstrates a failure to recognize the potential severity of respiratory signs and a lack of specialized knowledge expected of a VTS. It constitutes professional negligence by not adequately assessing the patient's condition, potentially leading to the progression of a serious disease. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with gathering all available information, owner report, signalment, followed by a comprehensive physical examination tailored to the presenting complaint. This includes a thorough respiratory assessment. Based on the findings, the VTS should then formulate a differential diagnosis list and communicate these findings and potential concerns to the attending veterinarian, recommending further diagnostic steps or immediate intervention as indicated. This process ensures patient safety, adherence to professional standards, and effective collaboration with the veterinary team. Question 3. Comparative studies suggest that precise feeding schedules and portion control are critical for the successful recovery of equine patients post-surgery. A veterinarian has prescribed a specific feeding regimen for a recovering horse, detailing exact amounts and timings for various feed types. As the VTS responsible for the horse's care, which of the following actions best upholds the veterinarian's orders and promotes optimal patient recovery? Option A. Increasing the feed portion slightly if the horse appears particularly hungry, assuming this will aid in faster recovery. Option B. Reducing the feed portions if the hospital is experiencing a high patient load and time is limited for meticulous administration. Option C. Administering the prescribed feed amounts and timings precisely as ordered by the veterinarian, while closely monitoring the horse's response and reporting any concerns. Option D. Feeding the horse based on what has historically been fed to similar cases in the past, without reconfirming the current veterinarian's specific instructions. Correct answer is C. Administering the prescribed feed amounts and timings precisely as ordered by the veterinarian, while closely monitoring the horse's response and reporting any concerns. Explanation: this scenario is professionally challenging because it requires the Certified Veterinary Technician Specialist, VTS, in equine nursing to balance the specific dietary needs of a recovering equine patient with the practical constraints of a busy veterinary hospital. The VTS must interpret and implement a veterinarian's feeding plan, ensuring accuracy and patient safety, while also considering the potential for complications arising from improper feeding. This requires a deep understanding of equine physiology, nutritional requirements, and the potential impact of feeding errors on recovery. The correct approach represents best professional practice because it prioritizes the patient's well-being and adheres strictly to the veterinarian's prescribed feeding schedule and portion control. This aligns with the ethical and regulatory obligations of veterinary professionals to provide competent and compassionate care. By meticulously following the veterinarian's orders, the VTS minimizes the risk of iatrogenic complications such as colic, laminitis, or metabolic disturbances, which could significantly hinder the horse's recovery and potentially lead to a worse prognosis. This approach demonstrates a commitment to evidence-based practice and patient safety, which are paramount in veterinary medicine. An incorrect approach that involves arbitrarily increasing portion sizes based on the horse's apparent hunger fails to acknowledge the specific therapeutic goals of the feeding plan. This could lead to overfeeding, potentially causing digestive upset or exacerbating underlying conditions, and directly violates the veterinarian's orders, constituting a breach of professional duty and potentially negligence. Another incorrect approach, which involves reducing portion sizes due to perceived ease of administration or time constraints, compromises the nutritional support essential for the horse's recovery. This can lead to malnutrition, delayed healing, and a weakened immune system, all of which are detrimental to the patient's prognosis and represent a failure to provide adequate veterinary nursing care as prescribed. A further incorrect approach, such as feeding based on historical feeding practices for similar conditions without consulting the current veterinarian's specific orders, ignores the individualized nature of patient care. Each horse's condition and recovery trajectory are unique, and relying on generalized knowledge without adhering to the current treatment plan can lead to inappropriate nutritional intake, potentially causing harm and failing to meet the specific needs of the patient. The professional decision-making process for similar situations should begin with a thorough understanding of the veterinarian's treatment plan, including all aspects of feeding. This involves clarifying any ambiguities in the orders and understanding the rationale behind the prescribed schedule and portions. The VTS must then implement the plan with precision, continuously monitoring the patient for any adverse reactions or signs of improvement. Open communication with the veterinarian regarding the patient's progress and any observed challenges is crucial for ensuring optimal patient outcomes and maintaining professional accountability. Question 4. Cost-benefit analysis shows that investing in advanced diagnostic interpretation of neurological deficits is crucial for optimal patient outcomes. A 5-year-old quarter horse presents with progressive ataxia and weakness, particularly in the hind limbs. The attending veterinarian suspects a lesion affecting the spinal cord. As the VTS equine nursing specialist, you are tasked with monitoring the horse's neurological status and assisting with nursing care. Considering the principles of neurotransmission and reflex arcs, which of the following nursing actions is most appropriate for assessing the integrity of the motor pathway and identifying potential areas of dysfunction? Option A. Performing a detailed assessment of proprioception and evaluating spinal reflexes, such as the patellar reflex and withdrawal reflex, noting the latency and amplitude of the response. Option B. monitoring vital signs, heart rate, respiratory rate, temperature, and ensuring adequate hydration. Option C, administering prescribed pain medication and observing for any changes in the horse's demeanor. Option D, providing a soft, padded stall and limiting the horse's movement to prevent injury. The correct answer is C, administering prescribed pain medication and observing for any changes in the horse's demeanor. Explanation: this scenario presents a professional challenge due to the critical nature of neurological conditions in equine patients and the direct impact on patient welfare and owner expectations. VTS equine nursing specialist must integrate advanced knowledge of neurotransmission and reflex arcs with practical application in a clinical setting, ensuring timely and accurate interventions. The complexity arises from the need to interpret subtle clinical signs, understand the underlying pathophysiology, and select appropriate nursing strategies that support veterinary medical treatment while adhering to established standards of care and ethical obligations. The correct approach represents best professional practice by prioritizing a thorough, systematic assessment of the patient's neurological status. This involves detailed observation of reflexes, muscle tone, and proprioception, directly correlating these findings with the known mechanisms of neurotransmission and reflex arcs. This methodical approach allows for accurate localization of the neurological deficit, which is crucial for guiding nursing interventions and supporting the veterinarian's diagnostic and therapeutic plan. Adherence to the VTS equine nursing scope of practice, which emphasizes advanced nursing care and patient monitoring, is paramount. This includes meticulous record keeping, clear communication with the veterinary team, and proactive management of potential complications, all of which are underpinned by a strong understanding of neurophysiology. An incorrect approach that relies solely on superficial observation without a deep understanding of reflex arc function would be a significant regulatory and ethical failure. This would constitute a breach of the VTS standard of care, as it fails to utilize specialized knowledge to its full potential. Ethically, it could lead to delayed or inappropriate nursing interventions, negatively impacting patient welfare and potentially violating the duty of care owed to the animal. Another incorrect approach might involve administering treatments or making diagnostic interpretations outside the VTS scope of practice, which would be a direct violation of Veterinary Practice Acts and regulatory guidelines governing veterinary technicians. This overstepping of professional boundaries can lead to patient harm and disciplinary action. Furthermore, failing to document findings or communicate critical observations to the attending veterinarian represents a breakdown in professional responsibility and a failure to uphold the collaborative nature of veterinary medicine, potentially leading to misdiagnosis or inadequate treatment. The professional decision-making process for similar situations should involve a tiered approach. First, a comprehensive review of the patient's history and presenting signs. Second, a systematic neurological examination, applying knowledge of neurotransmission and reflex arcs to interpret findings. Third, consultation with the attending veterinarian to discuss diagnostic and therapeutic strategies. And fourth, implementation of evidence-based nursing interventions tailored to the specific neurological deficit, with continuous monitoring and reevaluation. This process ensures that nursing care is informed, targeted, and aligned with the highest standards of professional practice and ethical responsibility. Question 5. To address the challenge of a horse presenting with increased respiratory effort, nasal discharge, and a mild fever in the absence of the attending veterinarian, what is the most appropriate immediate course of action for a certified veterinary technician specialist, VTS, in equine nursing? Option A. Independently collect a blood sample for arterial blood gas analysis to assess oxygenation levels. Option B. Administer a broad-spectrum antibiotic that has been previously prescribed for respiratory conditions, as a precautionary measure. Option C. Perform a thorough respiratory assessment including auscultation and vital signs, document findings, and immediately contact the supervising veterinarian to report the clinical signs and request further direction. Option D. Reassure the owner that the signs are mild and continue with routine monitoring, waiting for the veterinarian's scheduled return. The correct answer is C. Perform a thorough respiratory assessment including auscultation and vital signs, document findings, and immediately contact the supervising veterinarian to report the clinical signs and request further direction. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in equine respiratory nursing, distinguishing between a primary respiratory issue and a secondary complication, especially when presented with a complex clinical picture. The veterinarian's absence and the owner's anxiety add pressure, requiring the veterinary technician specialist, VTS, to exercise sound clinical judgment, prioritize patient welfare, and adhere to established protocols and ethical standards. The VTS must interpret subtle clinical signs, understand the potential etiologies of respiratory distress in horses, and act decisively within their scope of practice. Correct approach analysis. The correct approach involves a systematic assessment of the patient's respiratory status, including vital signs, auscultation findings, and observation of breathing patterns. This is followed by prompt communication with the supervising veterinarian, providing a concise and accurate summary of findings. This approach represents best professional practice because it prioritizes patient safety by ensuring a qualified veterinarian is informed of a potentially deteriorating condition. It aligns with the ethical responsibility to provide competent care and the regulatory framework that mandates veterinary supervision for diagnosis and treatment plans. The VTS's role is to gather data, perform nursing interventions within their scope, and facilitate veterinary decision-making, not to independently diagnose or prescribe. Incorrect approach is analysis. One incorrect approach involves administering a prescribed medication without confirming the veterinarian's current orders or the rationale for its use in the current context. This is a regulatory and ethical failure because it bypasses veterinary oversight for drug administration, potentially leading to inappropriate treatment, adverse drug reactions, or masking of critical signs. It violates the principle of acting under veterinary direction and could be considered practicing veterinary medicine without a license if the VTS were to make independent treatment decisions. Another incorrect approach is to dismiss the owner's concerns and focus solely on routine monitoring without escalating the situation. This is an ethical failure as it neglects the client's input, which can be a valuable source of information about the horse's history and subtle changes. It also fails to uphold the professional standard of proactive patient care and communication, potentially delaying necessary veterinary intervention and negatively impacting patient outcomes. A third incorrect approach is to independently initiate advanced diagnostic procedures, such as drawing blood for blood gas analysis, without explicit veterinary instruction. This is a regulatory failure as it exceeds the VTS's defined scope of practice, which typically requires veterinary direction for such interventions. It also poses a risk to the patient if not performed correctly or if the results are misinterpreted without veterinary guidance. Professional reasoning. When faced with a patient exhibiting signs of respiratory distress, especially in the absence of immediate veterinary presence, a VTS should follow a structured decision-making process. This involves 1. Rapidly assessing the patient's ABCs, airway, breathing, circulation, and vital signs. 2. Performing a thorough physical examination, focusing on the respiratory system, auscultation, observation of effort, mucous membrane color. 3. Documenting all findings meticulously. 4. Communicating findings and concerns clearly and concisely to the supervising veterinarian, providing a differential list of potential nursing interventions or diagnostic steps that could be considered. 5. Implementing nursing interventions as directed by the veterinarian and continuing to monitor the patient closely. This systematic approach ensures patient welfare, maintains professional boundaries, and adheres to regulatory and ethical obligations. Question 6. Compliance review shows that a certified veterinary technician specialist, VTS, equine nursing is preparing to administer a vitamin supplement to a hospitalized equine patient. Which of the following actions best ensures regulatory compliance and optimal patient care regarding the micronutrient? Option A. Administering the supplement based on general knowledge of common equine vitamin supplementation protocols without consulting the specific veterinary order for this patient. Option B. Proceeding with administration without confirming the current storage conditions of the micronutrient, assuming it has been stored appropriately. Option C. Relying on memory of how a similar micronutrient was administered to a different equine patient in the past. Option D. Verifying the specific micronutrient, its required dosage, the prescribed route of administration, and any special handling or storage instructions against the veterinary order and product information before dispensing or administering. The correct answer is D. Verifying the specific micronutrient, its required dosage, the prescribed route of administration, and any special handling or storage instructions against the veterinary order and product information before dispensing or administering. Explanation. Scenario analysis. This scenario presents a challenge in ensuring accurate and compliant administration of micronutrient supplements to equine patients. The complexity arises from the need to adhere to specific veterinary guidelines and potentially manufacturer instructions for a variety of vitamins and minerals, each with unique storage, preparation, and administration requirements. Mismanagement can lead to subtherapeutic dosing, toxicity, or degradation of the nutrient, impacting patient outcomes and potentially violating veterinary practice standards. The VTS equine nursing specialist must demonstrate a thorough understanding of these nuances to provide optimal patient care and maintain regulatory compliance. Correct approach analysis. The correct approach involves meticulously verifying the specific micronutrient, its required dosage, the prescribed route of administration, and any special handling or storage instructions prior to dispensing or administering. This aligns with best professional practice by prioritizing patient safety and efficacy. Regulatory frameworks for veterinary practice, including those governing veterinary technicians, emphasize the importance of accurate medication and supplement administration, adherence to veterinary orders, and maintaining proper records. This systematic verification process directly supports these requirements by minimizing the risk of error and ensuring that the supplement is provided as intended by the veterinarian, thereby upholding professional standards and patient welfare. Incorrect approaches analysis. One incorrect approach involves assuming the micronutrient is a standard supplement and administering it based on general knowledge of equine nutrition without consulting the specific veterinary order or product information. This fails to acknowledge the potential for variations in formulation, concentration, or recommended use between different products and species-specific needs, which could lead to incorrect dosing or administration. This directly violates the principle of following veterinary orders and could be considered a breach of professional responsibility and potentially a regulatory violation if it results in patient harm. Another incorrect approach is to rely solely on the memory of a previous administration of a similar micronutrient to the same or another patient. This is a significant professional and regulatory failure. Veterinary orders are specific to individual patients and conditions, and memory can be fallible. Administering a supplement based on recollection rather than current, verified orders increases the risk of errors in dosage, frequency, or route, which can have serious consequences for the horse's health and contravene regulations, requiring accurate record-keeping and adherence to prescribed treatments. A third incorrect approach is to proceed with administration without confirming the storage conditions of the micronutrient, especially if it is a temperature-sensitive or light-sensitive vitamin. Many vitamins degrade rapidly under improper storage, rendering them ineffective or potentially altering their chemical properties. Failure to verify storage conditions before administration means the dispensed product may not be of therapeutic value, leading to a failure to meet the intended treatment goals. This represents a lapse in professional diligence and a failure to ensure the quality and efficacy of the administered product, which is implicitly covered by regulations concerning the provision of veterinary care. Professional reasoning. Professionals should adopt a systematic multi-point verification process before administering any medication or supplement. This includes 1. Confirming the patient's identity and the specific veterinary order. 2. Verifying the identity and concentration of the micronutrient against the order and product labeling. 3. Checking the prescribed dosage and route of administration. 4. Reviewing any specific handling, storage, or preparation instructions. 5. Documenting the administration accurately. This structured approach minimizes cognitive biases and memory lapses, ensuring adherence to veterinary directives and regulatory requirements, thereby safeguarding patient welfare and upholding professional integrity. Question 7. The assessment process reveals a 15-year-old quarter horse gelding presenting with a history of colic that resolved with medical management 24 hours prior. The horse is currently bright and alert, eating hay, and has passed manure. However, upon palpation, the skin over the shoulder returns to its normal position approximately 3 seconds after being pinched. The capillary refill time is noted to be 2 seconds, and the gums appear moist and pink. Considering these findings in isolation and in combination, which of the following best reflects the horse's hydration status and the immediate nursing priority? Option A. The horse is likely experiencing mild dehydration and the priority is to encourage continued oral fluid intake and monitor closely for any changes. Option B. The horse is adequately hydrated, and no further intervention is required beyond routine monitoring. Option C. The horse is experiencing moderate dehydration, necessitating a change in diet to high-fiber feed. Option D. The horse is severely dehydrated, and immediate intravenous fluid therapy is indicated. The correct answer is A. The horse is likely experiencing mild dehydration, and the priority is to encourage continued oral fluid intake and monitor closely for any changes. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in equine nursing, assessing hydration status in a patient with a history of gastrointestinal distress. The complexity arises from the subtle nature of dehydration signs in horses, the potential for rapid deterioration, and the need to differentiate between mild, moderate, and severe dehydration. A VTS equine nursing specialist must integrate clinical observations with an understanding of physiological principles to make timely and accurate assessments, directly impacting patient outcomes and treatment efficacy. The challenge lies in interpreting a constellation of signs, not relying on a single indicator, and understanding the implications of each finding within the context of the horse's overall condition. Correct approach analysis. The correct approach involves a comprehensive evaluation of multiple hydration parameters, including skin turgor, capillary refill time, gum moisture, and the horse's demeanor and activity level. This multifaceted assessment aligns with best professional practices as outlined by veterinary nursing guidelines, which emphasize thorough patient assessment. By considering a range of indicators, the technician can form a more accurate picture of the horse's hydration status, allowing for appropriate intervention and monitoring. This approach is ethically sound as it prioritizes patient welfare through diligent observation and accurate assessment, fulfilling the duty of care expected of a VTS. Incorrect approaches analysis. One incorrect approach would be to solely rely on skin turgor. While a useful indicator, skin turgor can be influenced by factors such as age, body condition, and the specific location tested, leading to potential misinterpretation. This narrow focus fails to meet the standard of comprehensive assessment expected in professional veterinary nursing and could lead to delayed or inadequate treatment, violating the duty of care. Another incorrect approach would be to only consider capillary refill time. While a rapid capillary refill time can indicate poor perfusion, which is often associated with dehydration, it can also be affected by other cardiovascular issues. Over-reliance on this single parameter without corroborating evidence from other hydration indicators can lead to an incomplete or inaccurate diagnosis, representing a failure in professional diligence and potentially compromising patient safety. A third incorrect approach would be to assume the horse is adequately hydrated based on the absence of obvious signs of severe dehydration, such as extreme lethargy or sunken eyes. This reactive approach, waiting for overt symptoms, is contrary to proactive patient monitoring and early intervention principles. It neglects the subtle, early signs of dehydration that a specialist should be adept at recognizing, thereby failing to uphold the highest standards of equine nursing care and potentially allowing a condition to worsen unnecessarily. Professional reasoning. Professionals should approach hydration assessment by first understanding the horse's history and current clinical context. Then, systematically evaluate multiple physiological parameters: skin elasticity, checking multiple sites if necessary, capillary refill time, mucous membrane moisture and color, eyeball position, sunkenness, and the horse's general demeanor and willingness to drink. Correlating these findings with the patient's overall condition and any ongoing treatments allows for a more precise assessment. This systematic, evidence-based approach ensures that interventions are timely and appropriate, reflecting a commitment to the highest standards of patient care and professional responsibility. Question 8. Market research demonstrates a growing interest among equine owners in optimizing muscle development and recovery in performance horses. A VTS, equine nursing, is presented with a case of a 7-year-old quarter horse gelding exhibiting significant hind limb muscle atrophy. The owner reports the horse has been less responsive to training cues and appears weaker. The VTS must consider the potential underlying causes of this muscle wasting. Which of the following diagnostic and investigative approaches best aligns with the VTS's role in assisting with diagnosis and treatment planning under veterinary supervision, prioritizing accurate identification of the etiology? Option A. Perform a detailed neurological examination, including assessment of reflexes and proprioception, and discuss the findings with the attending veterinarian to determine if nerve damage is contributing to the atrophy, alongside evaluating for signs of disuse atrophy. Option B. Advise the owner that muscle atrophy is a common consequence of intense training and that it will resolve with rest. Option C. Recommend a high-protein supplement and increased exercise regimen based on the owner's observation of muscle loss and the horse's performance decline. Option D. Suggest a series of therapeutic laser treatments, assuming the atrophy is due to inflammation, without further diagnostic investigation. The correct answer is C. Recommend a high-protein supplement and increased exercise regimen based on the owner's observation of muscle loss and the horse's performance decline. Explanation. Scenario analysis. This scenario presents a challenge in differentiating between primary muscle atrophy due to disuse and secondary atrophy resulting from neurological insult, a common diagnostic dilemma in equine practice. Accurate differentiation is critical for effective treatment planning and prognosis, directly impacting the welfare of the equine patient and client expectations. Misdiagnosis can lead to inappropriate therapies, delayed recovery, and potential financial strain on the owner. Correct approach analysis. The correct approach involves a systematic evaluation that integrates clinical signs with diagnostic findings to pinpoint the underlying cause of muscle atrophy. This aligns with the VTS equine nursing's role in assisting with diagnosis and treatment under veterinary supervision, emphasizing evidence-based practice and patient-centered care. The VTS is expected to understand the nuances of muscle physiology and pathology to contribute meaningfully to the diagnostic process, adhering to the ethical imperative of providing the highest standard of care. This approach upholds the principles of responsible veterinary practice by seeking definitive answers to guide treatment. Incorrect approaches analysis. One incorrect approach focuses solely on the visible signs of muscle wasting without further investigation. This fails to meet the VTS standard of practice by neglecting the diagnostic process and potentially leading to a superficial understanding of the condition. Ethically, it falls short of the commitment to thorough patient assessment. Another incorrect approach relies on anecdotal evidence or owner reports without objective veterinary assessment. This is a significant regulatory and ethical failure, as it bypasses the veterinarian's expertise and the established protocols for diagnosis and treatment. It undermines the veterinarian client-patient relationship and can lead to misinformation and ineffective care. A third incorrect approach involves recommending a broad-spectrum treatment for muscle enhancement without a confirmed diagnosis. This is professionally irresponsible and ethically unsound, represents a failure to adhere to the principles of veterinary medicine, which mandate diagnosis before treatment. Such an approach could mask the true underlying condition, delay appropriate intervention, and potentially harm the horse. Professional reasoning. Professionals should approach such cases by first gathering a comprehensive history, followed by a thorough physical and neurological examination. This should then be complemented by diagnostic imaging, e.g., ultrasound, and potentially electrodiagnostic tests to differentiate between primary muscle issues and neurological deficits. The VTS's role is to facilitate these diagnostic steps and interpret findings under veterinary guidance, ensuring that treatment is tailored to the specific etiology of the muscle atrophy. This systematic, evidence-based approach is paramount for ethical and effective patient management. Question 9. Consider a scenario where you are the sole certified veterinary technician specialist, VTS, equine nursing on duty at a busy equine referral hospital. A client arrives unannounced with their horse, reporting acute onset of severe colic and signs of cardiovascular distress, including pale mucous membranes, weak pulse, and rapid respiration. The attending veterinarian is currently in surgery and unavailable for immediate consultation. You have assessed the horse and determined it requires immediate intervention, including potential administration of a potent analgesic and an antiarrhythmic medication, both of which are controlled substances. What is the most appropriate course of action to ensure regulatory compliance and optimal patient care in this situation? Option A. Prepare the necessary equipment for intravenous catheterization and fluid administration, and gather the analgesic and antiarrhythmic medications, ready for immediate administration upon the veterinarian's verbal or written order, while simultaneously attempting to contact the veterinarian via phone and pager. Option B. Administer the analgesic and antiarrhythmic medications from the controlled substance inventory to stabilize the horse while awaiting the veterinarian's availability. Option C. Initiate basic supportive care such as oxygen therapy and administer a non-controlled anti-inflammatory medication, and continue to wait for the veterinarian to become available before considering any further interventions. Option D. Contact the nearest veterinary emergency clinic to transfer the horse, as you are unable to provide the necessary advanced care without direct veterinary supervision. The correct answer is B. Administer the analgesic and antiarrhythmic medications from the controlled substance inventory to stabilize the horse while awaiting the veterinarian's availability. Explanation: this scenario presents a professional challenge due to the critical nature of cardiovascular emergencies in equine patients and the inherent limitations of veterinary technician practice, particularly concerning the administration of controlled substances and the scope of independent decision-making. The veterinarian's absence and the immediate need for intervention necessitate a technician operating within their defined legal and ethical boundaries while prioritizing patient welfare. The correct approach represents best professional practice because it adheres strictly to the established regulatory framework for Certified Veterinary Technician Specialists, VTS, in equine nursing within the specified jurisdiction. This involves recognizing the limitations of veterinary technician practice, particularly regarding the administration of controlled substances without direct veterinary supervision or a pre-established emergency protocol. The technician's action of preparing the necessary equipment and medications for immediate veterinary administration, while simultaneously attempting to contact the veterinarian, demonstrates a commitment to patient safety and regulatory compliance. This approach ensures that controlled substances are administered only under appropriate veterinary direction, preventing potential legal ramifications and ethical breaches related to unauthorized drug handling and administration. It prioritizes the veterinarian's ultimate responsibility for diagnosis and treatment planning, while allowing the technician to provide essential supportive care and prepare for timely intervention. An incorrect approach involving the independent administration of a controlled substance, such as a potent analgesic or antiarrhythmic, without direct veterinary order or a pre-approved emergency protocol, constitutes a significant regulatory and ethical failure. This action would likely violate veterinary practice acts that define the scope of veterinary technician practice, specifically regarding the dispensing and administration of prescription drugs, especially controlled substances. Ethically, it represents practicing veterinary medicine without a license or appropriate delegation, jeopardizing patient safety through potential misdiagnosis, incorrect dosage, or adverse drug reactions. Furthermore, it undermines the veterinarian-technician relationship, which is built on trust and adherence to established professional hierarchies and legal mandates. Another incorrect approach, such as delaying critical supportive care like oxygen therapy or intravenous fluid administration, while solely focusing on contacting the veterinarian, would be a failure in professional judgment and ethical responsibility. While regulatory compliance is paramount, the technician also has an ethical duty to provide immediate, life-sustaining care within their scope of practice when a patient is in distress. This approach neglects the immediate needs of the patient, potentially leading to irreversible harm or death, even if it avoids direct regulatory violations concerning controlled substances. A professional decision-making process in such a situation requires a rapid assessment of the patient's condition, identification of immediate life threats that can be addressed within the technician's scope of practice, and simultaneous efforts to obtain veterinary guidance for more advanced interventions. This involves a tiered approach. First, stabilize the patient with available, non-controlled resources. Second, prepare for interventions requiring veterinary direction. And third, actively seek that direction. Question 10. The investigation demonstrates that a 15-year-old quarter horse gelding, previously in good health, has presented with a dull coat, a noticeable decrease in top-line muscle mass, and a reluctance to engage during ridden exercise. The owner reports a recent change in feed to a less expensive, high-grain, low-forage ration due to financial constraints. Considering the macronutrient profile of this dietary shift and the horse's clinical presentation, which of the following represents the most immediate and significant macronutrient-related risk that requires further investigation and potential intervention? Option A. Excessive carbohydrate intake causing potential gastrointestinal upset and laminitis. Option B, imbalance in essential fatty acids affecting skin and coat health. Option C, fat deficiency impacting energy reserves and hormone production. Option D, potential protein deficiency leading to muscle catabolism and poor coat quality. The correct answer is D, potential protein deficiency leading to muscle catabolism and poor coat quality. Explanation: scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist to assess a horse's nutritional status and identify potential risks associated with macronutrient imbalances without direct veterinary supervision for initial assessment. The risk assessment must be based on observable clinical signs and historical data, demanding a nuanced understanding of how dietary deficiencies or excesses manifest in equine health. The technician must exercise sound judgment to differentiate between subtle signs of malnutrition and other potential health issues, ensuring the horse receives appropriate and timely nutritional support recommendations. Correct approach analysis. The correct approach involves a comprehensive risk assessment that prioritizes identifying the most immediate and significant macronutrient-related threats to the horse's health. This aligns with the VTS equine nursing scope of practice, which includes assisting in nutritional management and recognizing clinical signs of nutritional deficiencies or excesses. By focusing on the horse's current condition, body condition score, and observable signs of potential protein deficiency, e.g., poor coat quality, muscle wasting, the technician is employing a systematic and evidence-based method to identify a critical risk. This approach is ethically sound as it directly addresses the animal's welfare and is consistent with the professional responsibility to advocate for optimal patient care within the established regulatory framework for veterinary technicians. Incorrect approaches analysis. One incorrect approach would be to solely focus on the horse's recent diet history without correlating it to observable clinical signs. This fails to acknowledge that dietary intake alone does not always reflect actual nutrient absorption or utilization, and that clinical presentation is paramount in risk assessment. Ethically, this approach could lead to overlooking a critical health issue if the diet history is inaccurate or incomplete, potentially violating the duty of care. Another incorrect approach would be to recommend a broad spectrum of supplements without a targeted assessment of specific macronutrient deficiencies. This is not a risk assessment, but rather a generalized intervention. It is professionally unsound because it lacks specificity, may be financially burdensome for the owner, and could even exacerbate existing imbalances if not properly guided by a diagnosis. This deviates from best practice by not identifying and mitigating specific risks. A third incorrect approach would be to dismiss the observed clinical signs as unrelated to nutrition without further investigation. This demonstrates a failure to apply critical thinking and a lack of understanding of how macronutrient imbalances can manifest. It risks delaying necessary nutritional interventions, which is a failure in professional responsibility and could negatively impact the horse's health. Professional reasoning. Professionals should approach such situations by first gathering all available information, clinical observations, patient history, including diet, and any diagnostic data. A systematic risk assessment should then be performed, prioritizing potential threats based on their severity and likelihood. This involves correlating observed signs with known physiological effects of macronutrient imbalances. The technician should then formulate recommendations or escalate concerns to the veterinarian, always prioritizing the animal's welfare and adhering to their scope of practice and relevant regulations. Question 11. Upon reviewing a veterinarian's request for a feeding plan for a 2-day-old foal presenting with mild dehydration and lethargy, the Certified Veterinary Technician Specialist, VTS, equine nursing is tasked with developing a strategy. The owner has expressed concern about the cost of specialized milk replacers and has inquired about more economical alternatives. Which of the following approaches best aligns with professional veterinary nursing standards and ethical considerations for this scenario? Option A. Recommend a homemade milk replacer recipe sourced from an online forum, emphasizing its lower cost and readily available ingredients, and advise the owner to monitor the foal for any adverse reactions. Option B. Suggest feeding the foal mare's milk if available, without further investigation into the foal's specific nutritional needs or the mare's milk quality, and defer all detailed feeding decisions to the veterinarian. Option C. Develop a feeding plan that includes a commercially available, foal-specific milk replacer, supplemented with a probiotic, and present the owner with a detailed breakdown of costs and potential benefits, while also discussing less expensive, but still nutritionally complete, commercially available options if the primary recommendation is cost-prohibitive. Option D. Immediately prescribe a high-fat, high-protein milk replacer designed for premature foals, assuming the foal's lethargy indicates a severe underlying condition requiring aggressive nutritional support, without consulting the owner about cost or alternative options. The correct answer is C. Develop a feeding plan that includes a commercially available, foal-specific milk replacer, supplemented with a probiotic, and present the owner with a detailed breakdown of costs and potential benefits, while also discussing less expensive, but still nutritionally complete, commercially available options if the primary recommendation is cost-prohibitive. Explanation: this scenario is professionally challenging because it requires balancing the immediate needs of a foal with the long-term health and economic considerations of the owner, all while adhering to veterinary practice standards and ethical guidelines. The VTS equine nursing specialist must act as a knowledgeable advocate for the foal's welfare while respecting the owner's decisions and financial limitations. Careful judgment is required to ensure the feeding plan is both nutritionally sound and practically implementable. The correct approach represents best professional practice because it prioritizes a thorough assessment of the foal's individual needs, considering its age, health status, and any underlying conditions. This aligns with the veterinary principle of providing individualized patient care. Furthermore, it involves open and transparent communication with the owner, educating them on the rationale behind the feeding recommendations, and discussing various options that fit within their budget. This collaborative approach fosters trust and ensures compliance, ultimately benefiting the foal's recovery and long-term health. Adherence to established feeding protocols and guidelines for neonatal foals, as often found in veterinary textbooks and professional resources, is also a key component of best practice. An incorrect approach that involves immediately recommending the most expensive, specialized milk replacer, without assessing the foal's specific nutritional requirements or the owner's financial constraints, is professionally unacceptable. This fails to consider the economic realities faced by the owner and may lead to non-compliance or abandonment of the feeding plan. Ethically, it could be seen as prioritizing profit over patient welfare and owner partnership. Another incorrect approach, such as recommending a generic, unproven homemade milk replacer recipe found online, is also professionally unacceptable. This disregards established veterinary nutritional science and carries significant risks of nutritional deficiencies, imbalances, or even toxicity, which could severely harm the foal. This approach violates the principle of evidence-based veterinary medicine and could lead to adverse patient outcomes, potentially resulting in disciplinary action for practicing outside of accepted veterinary standards. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a comprehensive physical and nutritional assessment of the foal. Second, consult relevant veterinary literature and established feeding protocols for neonatal foals. Third, engage in a detailed discussion with the owner, understanding their concerns, resources, and ability to implement a plan. Fourth, present a range of evidence-based feeding options, clearly outlining the pros, cons, and costs of each. Finally, collaboratively develop and document a feeding plan that is tailored to the foal's needs and achievable for the owner, with a clear plan for ongoing monitoring and adjustments. Question 12. The monitoring system demonstrates an increase in rectal temperatures and the presence of serous nasal discharge in 3 horses housed in adjacent stalls within a large breeding facility. The facility has a history of both strangles and equine influenza outbreaks. Considering the potential for rapid transmission and the need for immediate intervention, which of the following actions represents the most appropriate initial response for the Certified Veterinary Technician Specialist, VTS, equine nursing? Option A. Continue routine herd management and monitor the symptomatic horses closely, awaiting further development of clinical signs before initiating isolation or contacting the veterinarian. Option B. Advise the farm manager to temporarily halt all horse movements within and out of the facility and begin a thorough cleaning of all communal feeding and watering equipment. Option C. Immediately isolate the 3 symptomatic horses to separate designated isolation stalls and notify the attending veterinarian of the clinical signs and the number of affected animals. Option D. Administer broad-spectrum antibiotics to all horses in the affected barn as a prophylactic measure and observe for improvement in the symptomatic horses. The correct answer is C. Immediately isolate the 3 symptomatic horses to separate designated isolation stalls and notify the attending veterinarian of the clinical signs and the number of affected animals. Explanation: the monitoring system demonstrates a rise in temperature and nasal discharge in multiple horses within a stable. This scenario is professionally challenging because it requires immediate and accurate identification of potential infectious disease outbreaks, specifically strangles or equine influenza, which can spread rapidly and have significant economic and welfare implications. The veterinary technician specialist, VTS, must act decisively to implement appropriate biosecurity measures and diagnostic protocols while adhering to established veterinary practice guidelines and regulatory requirements for disease reporting and control. The correct approach involves immediate isolation of affected and potentially exposed horses, thorough clinical assessment of all animals, and prompt communication with the veterinarian to initiate diagnostic testing and implement a comprehensive biosecurity plan. This aligns with best professional practice by prioritizing animal welfare, preventing disease transmission, and fulfilling ethical obligations to maintain a healthy equine population. Regulatory frameworks, such as those governing veterinary practice and animal health, mandate prompt reporting of suspected contagious diseases and adherence to established protocols for containment and eradication. An incorrect approach of delaying isolation and diagnostic testing until symptoms worsen poses a significant regulatory and ethical failure. This delay allows for further disease spread, increasing the risk to other animals and potentially the human handlers, violating the duty of care and potentially contravening regulations related to animal health and disease control. Another incorrect approach of relying solely on symptomatic treatment without diagnostic confirmation fails to address the underlying infectious agent, prolonging the outbreak and increasing the risk of complications, which is ethically unsound and may violate Veterinary Practice Acts requiring appropriate diagnostic investigation. Furthermore, failing to communicate findings promptly to the veterinarian represents a breakdown in the veterinary client-patient relationship and a failure to adhere to collaborative practice standards, potentially leading to misdiagnosis and inappropriate management. Professionals should employ a decision-making framework that prioritizes rapid assessment, risk stratification, and adherence to established protocols. This includes recognizing early signs of illness, understanding the potential for highly contagious diseases, implementing immediate containment measures, and collaborating closely with the veterinarian for diagnosis and treatment. The framework should also encompass knowledge of relevant regulatory requirements for disease reporting and biosecurity. Question 13. Examination of the data shows a veterinarian has requested the administration of a specific medication via a route that, based on your specialized knowledge of equine respiratory physiology, could significantly impair gas exchange in a critically ill foal. You have concerns that this intervention, while intended to address a primary condition, may exacerbate the foal's respiratory compromise. What is the most ethically and professionally appropriate course of action for a certified veterinary technician specialist, VTS, equine nursing in this situation? Option A. Refuse to administer the medication and inform the veterinarian that you will not proceed with the order due to your concerns, without further discussion or explanation. Option B. Administer the medication as directed by the veterinarian, assuming the veterinarian has considered all potential risks and has the ultimate authority in treatment decisions. Option C. Directly and respectfully discuss your concerns with the veterinarian, citing specific physiological reasons why the proposed route may negatively impact gas exchange, and propose alternative routes or interventions that could achieve the desired therapeutic effect with less risk. Option D. Immediately consult with a senior veterinary technician colleague for their opinion before speaking with the veterinarian about your concerns. The correct answer is C. Directly and respectfully discuss your concerns with the veterinarian, citing specific physiological reasons why the proposed route may negatively impact gas exchange, and propose alternative routes or interventions that could achieve the desired therapeutic effect with less risk. Explanation: scenario analysis. This scenario presents an ethical dilemma for a certified veterinary technician specialist, VTS. In equine nursing, the veterinarian has requested a specific intervention that, while potentially beneficial, carries significant risks to the horse's gas exchange and overall well-being. The VTS must balance the veterinarian's directive with their professional responsibility to advocate for the patient and uphold ethical standards of care, particularly concerning patient safety and the principle of do no harm. The challenge lies in navigating the hierarchy of veterinary medicine while ensuring the horse's best interests are prioritized, especially when the proposed action may compromise fundamental physiological processes like gas exchange. Correct approach analysis. The correct approach involves a direct, professional, and evidence-based discussion with the veterinarian. This aligns with the ethical guidelines and professional responsibilities of a VTS, which include patient advocacy and the application of specialized knowledge. By raising concerns about the potential negative impact on gas exchange and suggesting alternative, less invasive, or more appropriate interventions, the VTS is fulfilling their duty to provide the highest standard of care. This approach respects the veterinarian's authority while ensuring that patient safety and optimal physiological function are paramount, adhering to the principles of responsible veterinary practice. Incorrect approaches analysis. One incorrect approach involves blindly following the veterinarian's order without question. This is a failure of professional responsibility and patient advocacy. Ethically, it violates the principle of do no harm by potentially exposing the horse to unnecessary risk without due diligence. Legally and professionally, it could be construed as negligence if the negative outcome is a direct result of an unexamined directive that a competent VTS should have questioned. Another incorrect approach is to refuse to perform the procedure without any communication or explanation to the veterinarian. This demonstrates a lack of professional collaboration and can create an adversarial relationship. While the VTS's concern is valid, the method of addressing it is unprofessional and does not contribute to a solution. This could be seen as insubordination and a failure to engage in the collaborative decision-making process essential in veterinary medicine. A third incorrect approach is to seek advice from a colleague without first discussing concerns with the veterinarian. While peer consultation can be valuable, bypassing the primary veterinarian in this situation is unprofessional. It undermines the veterinarian-client-patient relationship and can lead to miscommunication or delayed appropriate action. The VTS's primary responsibility is to communicate directly with the veterinarian about patient care concerns. Professional reasoning. Professionals should approach such situations by first gathering all relevant data and assessing the proposed intervention against their specialized knowledge and ethical obligations. The next step is to initiate a direct, respectful, and evidence-based dialogue with the veterinarian, clearly articulating concerns and proposing alternative solutions. If concerns remain unaddressed and the proposed action continues to pose a significant risk, the professional should escalate the concern through appropriate channels within the practice or regulatory body, always prioritizing patient welfare. Question 14. Performance analysis shows an equine patient exhibiting reduced appetite, mild lethargy, and a slightly dull hair coat. Further investigation reveals a decrease in the production of key volatile fatty acids, VFA, within the hindgut. Considering the digestive processes and enzyme functions in equines, which of the following best explains the most likely underlying physiological issue contributing to these clinical signs? Option A. Insufficient secretion of pancreatic enzymes, such as amylase and lipase, impacting nutrient breakdown in the small intestine. Option B. Dehydration leading to reduced gut motility and a general slowdown of all digestive processes. Option C. A primary deficiency in salivary amylase, hindering the initial breakdown of carbohydrates in the mouth. Option D. Impaired microbial fermentation in the hindgut leading to reduced VFA production, which are essential energy substrates for colonocytes. The correct answer is D. Impaired microbial fermentation in the hindgut leading to reduced VFA production, which are essential energy substrates for colonocytes. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist to interpret subtle clinical signs related to digestive function in an equine patient and to correlate these with specific enzymatic processes. The challenge lies in distinguishing between a primary digestive issue and a secondary consequence of altered enzyme activity, necessitating a nuanced understanding of equine physiology and the impact of various factors on digestion. Accurate assessment is critical for timely and effective intervention, impacting patient welfare and treatment outcomes. Correct approach analysis. The correct approach involves recognizing that a decrease in volatile fatty acid, VFA, production, particularly acetate and butyrate, is a direct indicator of impaired microbial fermentation in the hindgut. These VFAs are the primary energy source for the equine colonocytes. Therefore, a reduction in their production signifies a compromised digestive process at the microbial level, which directly impacts the energy supply to the gut lining. This understanding aligns with best professional practice by focusing on the fundamental physiological consequences of digestive dysfunction, allowing for targeted diagnostic and therapeutic strategies. This approach is ethically sound as it prioritizes patient well-being through accurate physiological assessment. Incorrect approaches analysis. One incorrect approach would be to solely focus on the presence of colic signs without considering the underlying enzymatic or microbial contribution. While colic is a symptom, it doesn't pinpoint the root cause of digestive upset. This approach risks misdiagnosis and delayed or inappropriate treatment, potentially leading to patient harm, which is an ethical failure. Another incorrect approach would be to assume that increased water intake alone will resolve the issue. While hydration is important, it does not address the fundamental problem of reduced VFA production and its impact on hindgut health. This approach is a superficial intervention that fails to address the core physiological deficit, representing a failure in professional diligence and potentially leading to a worsening of the patient's condition. A further incorrect approach would be to attribute the signs solely to a lack of specific digestive enzymes produced by the horse's own glands, e.g., pancreatic enzymes. While these enzymes are crucial for foregut digestion, the described scenario points more directly to hindgut fermentation issues, which are driven by microbial activity and the subsequent production of VFAs. Focusing exclusively on pancreatic enzyme function would overlook the primary site of the problem and lead to an ineffective treatment plan, thus failing to meet the standard of care. Professional reasoning. Professionals should approach such scenarios by first performing a thorough clinical assessment, including a detailed history and physical examination. This should be followed by a systematic evaluation of the digestive system, considering both foregut and hindgut functions. The technician specialist should then correlate observed clinical signs with known physiological processes and enzymatic functions. When faced with ambiguous signs, it is crucial to consider the most likely physiological derangements based on the available evidence. This systematic, evidence-based approach, prioritizing the understanding of fundamental physiological mechanisms, ensures that diagnostic and therapeutic decisions are well-informed and ethically sound, ultimately promoting optimal patient care. Question 15. Operational review demonstrates that an equine patient diagnosed with colic, suspected to be related to dietary indiscretion, has been prescribed a specific low-starch, high-fiber diet by the veterinarian. The owner, however, expresses strong reservations, citing advice from a fellow horse owner who advocates for a high-grain diet for colic recovery, believing it provides faster energy. The owner is hesitant to implement the prescribed diet and is seeking reassurance that the veterinarian's recommendation is indeed the best course of action. As the Certified Veterinary Technician Specialist, VTS, in equine nursing, how should you ethically and professionally address this situation? Option A. Provide a general overview of equine nutrition, including various dietary options, without specifically endorsing or refuting the owner's friend's advice or the veterinarian's plan to avoid conflict. Option B. Immediately agree to the owner's request for a high-grain diet, as the owner is ultimately responsible for the horse's care and their wishes should be prioritized. Option C. Inform the owner that their friend's advice is incorrect and that they should strictly follow the veterinarian's orders without question, as the veterinarian is the expert. Option D. Explain the veterinarian's rationale for the low-starch, high-fiber diet, detailing how it supports gut health and reduces the risk of further digestive upset, while also acknowledging the owner's concerns and offering to discuss them further with the veterinarian. The correct answer is D. Explain the veterinarian's rationale for the low-starch, high-fiber diet, detailing how it supports gut health and reduces the risk of further digestive upset, while also acknowledging the owner's concerns and offering to discuss them further with the veterinarian. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the veterinary technician specialist to balance immediate patient needs with long-term owner compliance and understanding. The owner's perception of the cause of colic, influenced by anecdotal information, directly conflicts with evidence-based nutritional recommendations. Navigating this requires not only technical knowledge, but also strong communication and ethical judgment to ensure the horse receives appropriate care without alienating the owner. The VTS must act as an advocate for the horse's well-being while respecting the owner's role in decision-making. Correct approach analysis. The correct approach prioritizes evidence-based veterinary recommendations and clear communication. By presenting the veterinarian's findings and the rationale behind the dietary changes, the VTS empowers the owner with accurate information. This aligns with the ethical obligation to provide competent care and to educate clients to the best of one's ability, fostering a collaborative approach to patient management. This approach upholds the principles of client education and informed consent, crucial for successful treatment outcomes and adherence to veterinary guidance. Incorrect approaches analysis. One incorrect approach involves dismissing the owner's concerns and rigidly enforcing the veterinarian's plan without further explanation. This fails to acknowledge the owner's perspective and can lead to distrust and noncompliance, potentially jeopardizing the horse's recovery. Ethically, it neglects the importance of client communication and partnership in veterinary care. Another incorrect approach is to immediately concede to the owner's request for a different diet without adequate veterinary assessment or justification. This prioritizes owner satisfaction over the horse's medical needs and could lead to a recurrence or worsening of colic, violating the VTS's duty of care and professional responsibility to advocate for the animal's health. A third incorrect approach is to provide vague or overly technical nutritional advice that the owner cannot understand or implement. This demonstrates a failure in effective communication and client education, leaving the owner feeling confused and unsupported, and potentially leading to improper feeding practices. Professional reasoning. Professionals should approach such situations by first actively listening to the owner's concerns and understanding their perspective. Then, they should clearly and calmly explain the veterinarian's diagnosis and the scientific rationale behind the recommended nutritional plan, using language that is accessible to the owner. The goal is to build trust and facilitate informed decision-making, ensuring the horse receives the best possible care. This involves a commitment to ongoing client education and a willingness to address questions and concerns throughout the treatment process. Question 16. Analysis of a scenario where an equine owner is distressed by the prolonged recovery time and associated costs of their horse's complex tibial fracture. A VTS in equine nursing is tasked with discussing the healing process, considering the owner's emotional state and financial concerns, which approach best aligns with the regulatory framework and ethical guidelines for a VTS in equine nursing in the U.S. Option A. Advise the owner on alternative, less expensive treatment options that might expedite healing, even if they are not the veterinarian's primary recommendation, and suggest ways to manage the horse at home with minimal veterinary oversight. Option B. Offer a personal opinion on the horse's prognosis based on anecdotal evidence from other cases, without consulting the attending veterinarian, and suggest discontinuing treatment if the owner feels the financial burden is too great. Option C. Reassure the owner that the fracture will heal quickly and that the costs will likely decrease significantly in the coming weeks, focusing primarily on positive outcomes to alleviate their immediate anxiety. Option D. Provide the owner with a detailed explanation of the biomechanics of bone healing, emphasizing the typical timelines for fracture consolidation in large animals, and clearly outline the veterinarian's recommended treatment plan, including potential complications and the rationale behind each step, while also facilitating a discussion about realistic expectations for the horse's return to previous function. The correct answer is D. Provide the owner with a detailed explanation of the biomechanics of bone healing, emphasizing the typical timelines for fracture consolidation in large animals, and clearly outline the veterinarian's recommended treatment plan, including potential complications and the rationale behind each step, while also facilitating a discussion about realistic expectations for the horse's return to previous function. Explanation. This scenario presents a professional challenge due to the inherent variability in equine bone healing and the potential for owner-driven decisions to impact patient outcomes. The veterinary technician specialist, VTS, in equine nursing must navigate owner expectations, financial constraints, and the biological realities of bone repair, all while adhering to the highest standards of patient care and professional conduct. Careful judgment is required to balance these factors and provide accurate, evidence-based guidance. The correct approach represents best professional practice because it prioritizes the horse's welfare and aligns with the VTS's role as an advocate for the animal. By consulting with the attending veterinarian and providing the owner with comprehensive, realistic information about the prognosis, treatment options, and potential complications, the VTS ensures informed consent and promotes a collaborative approach to care. This upholds the ethical obligation to act in the best interest of the patient and demonstrates adherence to the principles of veterinary medicine, which emphasize evidence-based decision-making and clear communication. The VTS's role is to support the veterinarian's treatment plan and facilitate the owner's understanding, not to make independent treatment decisions or offer unsubstantiated hope. An incorrect approach that focuses solely on the owner's immediate financial concerns without adequately addressing the horse's prognosis or the veterinarian's recommendations would be professionally unacceptable. This could lead to suboptimal treatment, prolonged suffering for the horse, and potential legal or ethical repercussions for the veterinary team. It fails to uphold the VTS's duty of care and could be construed as practicing veterinary medicine without a license if it involves offering specific treatment advice outside the scope of their delegated responsibilities. Another incorrect approach that involves making definitive prognoses or treatment recommendations without direct veterinary consultation is a significant ethical and regulatory failure. This oversteps the VTS's scope of practice, potentially misinforming the owner and jeopardizing the horse's health. It undermines the veterinarian-client-patient relationship and violates the principles of responsible veterinary care. A third incorrect approach that involves withholding critical information about the complexity of bone healing or potential complications, perhaps to avoid upsetting the owner, is also professionally unacceptable. This lack of transparency erodes trust and prevents the owner from making truly informed decisions. It is an ethical failure to not fully disclose all relevant information that impacts the patient's well-being and the owner's understanding of the situation. The professional decision-making process for similar situations should involve a clear understanding of the VTS's scope of practice, a commitment to open and honest communication with both the veterinarian and the owner, and a prioritization of the patient's welfare above all else. This includes actively listening to the owner's concerns, seeking clarification from the veterinarian on all aspects of the case, and presenting information in a clear, compassionate, and accurate manner. The VTS should always operate as a supportive member of the veterinary team, facilitating the best possible outcome for the equine patient. Question 17. Benchmark analysis indicates a 10-year-old quarter horse gelding, previously performing at a high level, has shown a gradual decline in stamina and responsiveness over the past 6 weeks. The owner reports recently switching the horse to a new brand of commercially prepared performance feed approximately 2 months ago, and also notes a slight decrease in water intake. The VTS is tasked with evaluating the horse's current condition and potential contributing factors. Which of the following approaches best reflects professional best practice in addressing this situation? Option A. Focus on increasing the horse's exercise intensity to help the horse work through the perceived decline in performance. Option B. Conduct a thorough review of the horse's current and previous diets, including specific nutrient profiles if available. Observe the horse's general demeanor and body condition, and discuss the owner's observations and concerns in detail with the attending veterinarian to formulate a diagnostic and management plan. Option C. Recommend the owner administer a broad-spectrum electrolyte supplement daily, as decreased water intake often suggests an electrolyte imbalance. Option D. Advise the owner to immediately switch back to the previous feed brand and increase the current feed ration by 20% to compensate for any potential energy deficit. Correct answer is B. Conduct a thorough review of the horse's current and previous diets, including specific nutrient profiles if available. Observe the horse's general demeanor and body condition, and discuss the owner's observations and concerns in detail with the attending veterinarian to formulate a diagnostic and management plan. Explanation. This scenario is professionally challenging because it requires the Certified Veterinary Technician Specialist, VTS, In equine nursing, to interpret subtle clinical signs and historical data to identify a potential nutritional imbalance in a performance horse. The horse's performance decline, coupled with specific dietary changes, necessitates a nuanced understanding of equine nutrition beyond basic feeding guidelines. The VTS must consider the complex interplay between diet, physiology, and performance, while adhering to the ethical and regulatory standards governing veterinary practice. This involves recognizing the limits of their scope of practice and collaborating effectively with the veterinarian. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based evaluation of the horse's nutritional status in collaboration with the veterinarian. This aligns with the VTS's role in assisting with diagnosis and treatment planning, ensuring the horse receives appropriate care. By gathering comprehensive data, including detailed dietary history, clinical signs, and potentially diagnostic testing, the VTS provides the veterinarian with the necessary information to make an informed diagnosis and develop a targeted nutritional intervention. This collaborative approach upholds the highest standards of patient care and professional responsibility, ensuring that any nutritional recommendations are made within the scope of veterinary medicine and are tailored to the individual horse's needs. This also adheres to the principle of acting under the direction of a licensed veterinarian for diagnosis and treatment. An incorrect approach that involves independently recommending a specific supplement without veterinary consultation is a regulatory and ethical failure. This constitutes practicing veterinary medicine without a license, as diagnosing nutritional deficiencies and prescribing treatments falls under the purview of the veterinarian. It bypasses the essential step of veterinary assessment and diagnosis, potentially leading to inappropriate or even harmful interventions. Furthermore, it violates the principle of client communication and informed consent, as the owner is not receiving advice directly from the licensed veterinarian responsible for the horse's overall health. Another incorrect approach, focusing solely on increasing the quantity of current feed without considering the quality or balance of the diet, is also professionally deficient. This demonstrates a lack of deep analysis of the nutritional problem. While increasing calories might seem like a solution for performance decline, it fails to address the root cause if the issue is a specific deficiency or excess of certain nutrients within the existing feed. This approach could exacerbate an existing imbalance or fail to correct the underlying problem, leading to continued poor performance or the development of new health issues. It lacks the critical evaluation required for effective nutritional management and deviates from best practices in equine husbandry and veterinary support. Finally, an approach that dismisses the owner's concerns about the diet as insignificant without thorough investigation is professionally unacceptable. This demonstrates a failure to listen to the client and to consider all potential contributing factors to the horse's condition. The owner's observations, particularly regarding recent dietary changes, are valuable pieces of information that should be integrated into the diagnostic process. Ignoring these concerns can lead to a misdiagnosis and a failure to provide adequate care, potentially damaging the veterinarian-client relationship and violating ethical obligations to provide diligent and compassionate care. Question 18. Process analysis reveals that a 15-year-old quarter horse gelding presents with a history of intermittent hind limb lameness, which has recently worsened. The owner reports that the horse has been on a pasture diet and has had his hooves trimmed every 8 weeks. Upon physical examination, the veterinarian notes increased digital pulses in both hind limbs and mild heat in the coronary bands. The veterinarian suspects a diagnosis of navicular disease, possibly exacerbated by underlying metabolic issues. As the VTS specializing in equine nursing, you are tasked with assisting in the management of this horse. Which of the following approaches best aligns with the regulatory framework and ethical guidelines for a VTS in equine nursing in the United States? Option A. Advise the owner to immediately switch the horse to a grain-heavy diet to provide more energy for movement and suggest over-the-counter pain relievers available at the feed store, as these are often effective for mild lameness. Option B. Recommend that the owner cease all strenuous activity and confine the horse to a small stall indefinitely, as this is the safest approach for any horse experiencing lameness, without further veterinary consultation. Option C. Based on your experience, prescribe a specific anti-inflammatory medication and a joint supplement for the horse, and instruct the owner on its administration, without direct veterinary input on the specific drug choice or dosage. Option D. Implement a comprehensive nursing care plan that includes pain management, therapeutic shoeing recommendations, in conjunction with the farrier and veterinarian, dietary adjustments to address potential metabolic components, and regular monitoring of the horse's gait and comfort, while meticulously documenting all interventions and observations. The correct answer is D. Implement a comprehensive nursing care plan that includes pain management, therapeutic shoeing recommendations in conjunction with the farrier and veterinarian, dietary adjustments to address potential metabolic components, and regular monitoring of the horse's gait and comfort, while meticulously documenting all interventions and observations. Explanation: this scenario presents a professionally challenging situation because it requires the Certified Veterinary Technician Specialist, VTS, in equine nursing to balance immediate client needs with the long-term health and welfare of the equine patient, while adhering strictly to the regulatory framework governing veterinary practice in the United States. The VTS must exercise sound professional judgment in recommending and implementing treatment plans for complex non-infectious diseases like laminitis and navicular disease, which often have multifactorial causes and require ongoing management. The challenge lies in interpreting diagnostic findings, understanding the nuances of each condition, and communicating effectively with the veterinarian and the owner to ensure optimal outcomes within the scope of practice and ethical guidelines. The correct approach represents best professional practice because it prioritizes evidence-based medicine, patient welfare, and adherence to the Veterinary Practice Act of the relevant U.S. state and AVMA guidelines. This involves a thorough assessment of the horse, collaboration with the veterinarian to establish a diagnosis and treatment plan, and diligent implementation of that plan, including client education and monitoring. This approach aligns with the VTS's role as a skilled professional capable of advanced nursing care and support, ensuring the horse receives the highest standard of care. It also upholds the ethical obligation to act in the best interest of the animal and to maintain professional competence. An incorrect approach that involves solely relying on anecdotal evidence or owner preference without veterinary consultation would represent a significant regulatory and ethical failure. This would violate the Veterinary Practice Act by practicing veterinary medicine without a veterinarian's direct supervision or by providing advice outside the scope of the VTS's independent practice authority. Ethically, it would fail to uphold the duty of care to the animal and could lead to inappropriate or harmful treatment. Another incorrect approach, such as neglecting to document the nursing care provided or failing to communicate significant changes in the horse's condition to the veterinarian, would be a failure in record-keeping and professional communication, both of which are mandated by regulatory bodies and essential for continuity of care and legal protection. This could also lead to a breakdown in the veterinarian-client-patient relationship. Professionals should employ a decision-making framework that begins with a comprehensive patient assessment, followed by consultation with the supervising veterinarian to establish a diagnosis and treatment plan. This framework should then incorporate diligent implementation of the plan, continuous monitoring of the patient's response, and clear, consistent communication with both the veterinarian and the owner. Ethical considerations, including patient welfare and professional integrity, should guide every step. Adherence to state veterinary practice acts and relevant professional guidelines, e.g., AVMA, is paramount. Question 19. Research into the impact of early-stage colic signs on the overall prognosis of equine patients reveals that a VTS in equine nursing is responsible for monitoring a horse exhibiting mild abdominal discomfort. Which of the following approaches best demonstrates the VTS's commitment to advanced patient care and adherence to professional standards? Option A. Administering prescribed analgesics and anti-inflammatories as directed by the veterinarian, and then continuing routine monitoring of vital signs without further detailed gastrointestinal assessment until the next scheduled medication. Option B. Relying on the fact that the horse has a history of similar mild colic episodes that resolved with previous treatments, and therefore administering the previously successful medication regimen without a current physical assessment. Option C. Performing a thorough and repeated physical examination, including detailed auscultation of gastrointestinal motility, palpation for distension or pain, assessment of hydration status, and prompt communication of any subtle but concerning changes in demeanor or physical findings to the attending veterinarian. Option D. Waiting to report any changes in the horse's behavior or gut sounds until they become overtly obvious and clearly indicative of severe distress, assuming mild discomfort is a normal variation. Correct answer is A. Administering prescribed analgesics and anti-inflammatories as directed by the veterinarian, and then continuing routine monitoring of vital signs without further detailed gastrointestinal assessment until the next scheduled medication. Explanation. This scenario is professionally challenging due to the critical nature of digestive system disorders in equine patients, which can rapidly deteriorate and lead to life-threatening complications. The veterinary technician specialist, VTS, in equine nursing must possess a deep understanding of the equine digestive tract's unique physiology and common pathologies to accurately assess patient status and implement appropriate nursing interventions. The challenge lies in distinguishing between subtle clinical signs that may indicate a minor issue versus those signaling a severe emergency, requiring prompt and precise action. Careful judgment is paramount to ensure patient welfare and to avoid delays in critical care. The correct approach represents best professional practice because it prioritizes a comprehensive and systematic assessment of the equine patient's digestive status, integrating vital sign monitoring, detailed physical examination findings, and a thorough review of the diagnostic and treatment plan. This aligns with the ethical and professional standards expected of a VTS in equine nursing, emphasizing evidence-based practice and patient-centered care. Specifically, it reflects the responsibility to advocate for the patient by identifying and communicating significant changes in condition to the veterinarian, thereby facilitating timely and effective medical management. This approach upholds the VTS's role in providing advanced nursing care and contributing to positive patient outcomes. An incorrect approach that focuses solely on administering prescribed medications without a concurrent, thorough reassessment of the patient's overall condition represents a failure to exercise independent professional judgment and a potential breach of the VTS's duty of care. This approach neglects the dynamic nature of equine digestive diseases and the possibility of developing complications or adverse reactions to treatment. Ethically, it falls short of the proactive monitoring and assessment required for advanced nursing practice. Regulatory frameworks for veterinary technicians, particularly specialists, mandate a higher level of critical thinking and patient assessment beyond simple task execution. Another incorrect approach, which involves delaying reporting subtle but potentially significant changes in the patient's demeanor or gastrointestinal motility to the veterinarian due to a belief that the changes are not yet critical, is a significant ethical and professional failing. This demonstrates a lack of understanding of the rapid progression of some equine digestive issues and a failure to adhere to the principle of early intervention. It can lead to delayed diagnosis and treatment, negatively impacting the patient's prognosis and potentially violating standards of care. The VTS has a responsibility to be vigilant and to err on the side of caution when assessing potentially serious conditions. A further incorrect approach, such as relying solely on historical data from previous similar cases without performing a current, detailed physical examination, is also professionally unacceptable. While historical data can be informative, each patient is an individual, and their current condition may differ significantly. This approach demonstrates a lack of thoroughness and a failure to adapt care to the immediate needs of the patient, which is a cornerstone of effective veterinary nursing. It bypasses the essential step of direct patient assessment, which is crucial for identifying emergent issues. The professional decision-making process for similar situations should involve a structured approach. 1. Initiate a comprehensive patient assessment including vital signs, physical examination, auscultation of gut sounds, palpation, assessment of hydration, mucous membrane color, etc., an evaluation of the patient's overall demeanor and comfort level. 2. Review the veterinarian's treatment plan and diagnostic findings. 3. Continuously monitor the patient for any changes, no matter how subtle. 4. Critically analyze the collected data, correlating current findings with the patient's history and diagnosis. 5. Communicate any significant changes or concerns promptly and clearly to the attending veterinarian, providing specific observations and data. 6. Document all assessments, interventions, and communications accurately. 7. Anticipate potential complications and be prepared to implement further nursing interventions as directed or as per established protocols. Question 20. The control framework reveals that a certified veterinary technician specialist, VTS, equine nursing is responsible for obtaining accurate vital signs. When assessing a 12-year-old quarter horse gelding presented for colic, which of the following approaches best demonstrates adherence to the principles of accurate and contextually relevant vital sign assessment? Option A. Rectally measure the horse's temperature. Palpate the femoral pulse for rate and rhythm, and observe the respiratory rate and effort while noting any signs of distress or environmental factors. Option B. Record the vital signs as they were at the previous veterinary visit without reassessing, assuming the horse's condition has not significantly changed. Option C. Use an ear thermometer to measure the horse's temperature, palpate the digital pulse, and rely on the horse's owner to report the respiratory rate. Option D. Obtain a single rectal temperature reading and assume it is accurate. Then estimate the pulse rate by listening to the heart and visually counting chest movements for respiration. The correct answer is A. Rectally measure the horse's temperature, palpate the femoral pulse for rate and rhythm, and observe the respiratory rate and effort while noting any signs of distress or environmental factors. Explanation. Scenario analysis. This scenario is professionally challenging because accurately assessing vital signs in an equine patient requires not only technical skill, but also an understanding of normal physiological ranges, potential variations due to stress or environment, and the ability to interpret subtle changes. The veterinarian relies on the VTS equine nursing specialist to provide precise and reliable data to guide diagnostic and therapeutic decisions. Failure to obtain accurate readings can lead to misdiagnosis, delayed treatment, or inappropriate interventions, all of which have significant ethical and professional implications. Correct approach analysis. The correct approach involves a systematic and thorough assessment of temperature, pulse, and respiration, utilizing appropriate techniques and equipment for equine patients. This includes selecting the correct thermometer placement, rectal is standard for core temperature, ensuring proper pulse palpation, femoral artery is common, and observing respiratory effort and rate. The specialist must also be aware of factors that can influence these readings, such as ambient temperature, the horse's activity level, and any underlying pain or distress. This meticulous approach aligns with the core ethical duty of providing competent care and upholding professional standards as expected within the veterinary regulatory framework for veterinary technicians. It directly supports the veterinarian's ability to make informed decisions, fulfilling the VTS specialist's role in patient management. Incorrect approach is analysis. One incorrect approach would be to rely solely on a single reading without considering potential confounding factors or performing a recheck if readings appear abnormal. This demonstrates a lack of thoroughness and a failure to exercise the professional judgment expected of a VTS specialist. Ethically, this could be considered negligence, as it deviates from the standard of care and could lead to patient harm. Regulatory frameworks emphasize the importance of accurate data collection for patient well-being. Another incorrect approach would be to use equipment that is not calibrated or appropriate for equine use, or to employ techniques that are known to be less accurate, e.g., attempting to palpate a pulse in an area with poor accessibility, or using a non-rectal thermometer for core temperature without justification. This demonstrates a lack of technical proficiency and a disregard for established best practices, which are often implicitly or explicitly outlined in regulatory guidelines for specialized veterinary nursing. Such actions could be viewed as practicing outside the scope of competent care. A third incorrect approach would be to record readings without noting any relevant observations, such as the horse's demeanor, environmental conditions, or any signs of discomfort during the assessment. This fails to provide a complete clinical picture and limits the veterinarian's ability to interpret the vital signs in context. Professional veterinary practice, as guided by regulatory bodies, requires comprehensive documentation and contextualization of patient data. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient safety and accurate data acquisition. This involves 1. Understanding the normal physiological parameters for the species and individual patient. 2. Selecting and utilizing appropriate diagnostic tools and techniques. 3. Critically evaluating the obtained data, considering all influencing factors. 4. Documenting findings comprehensively and communicating any concerns or anomalies to the veterinarian promptly. This systematic approach ensures that the VTS equine nursing specialist acts as a reliable and integral part of the veterinary team, upholding the highest standards of care and adhering to regulatory expectations.